experts, and David Rosenberg, Dr. Rosenberg, is chair of the Department of Psychiatry at the Wayne State School of Medicine, and so many people, all of you who work in the area of behavioral health, members of the law enforcement community, students, community members, thank you so much for coming together today. We know that 1 out of 4 people every year is affected in some way by mental illness. So this is a big deal. And it was 51 and a half years ago that President Kennedy signed the first Community Mental Health Act. So we've been struggling to get to where he proposed we go for an awfully long time, and it's been a lot of ups and a lot of downs. So it's time to raise the bar, as you know, on treating mental health, and I'm so glad that that is, in fact, the theme of your conference. We've seen a number of things happen recently. With the Affordable Care Act, I was very proud to sponsor the provisions, as you know, that brings mental health parity and substance abuse parity for health insurance. So we have raised the bar there, and we need to make sure that insurance companies are following through, that there aren't different co-pays and aren't different matches and lengths of time that you can receive treatment for behavioral health issues versus physical health issues. So that's now in law. And with the Excellence in Mental Health Act pilot program, as you know, that I authored with my Republican colleague, Senator Roy Blunt, last year, we are raising the bar again in terms of what we expect and will support in the community. The good news is that the applications are now available for states, and I know that everybody's working hard in Michigan to be able to put together a fantastic proposal to get a planning grant, and then next year working hard to be one of the 8 pilot states where we will actually see the positive impacts of actually providing full reimbursement for behavioral health services and creating a qualified behavioral health clinic designation, as we do with federally qualified health centers. Bottom line, treating healthcare above the neck the same as healthcare below the neck. I want to congratulate everyone at Wayne State who's involved in the face-to-face inpatient diversion program, because this really is a model for what we can do in mental health reform, and shows how important it is to have a central psychiatric emergency service available for people that are struggling with mental illnesses or substance abuse. That's part of the requirements we put in this new certification plan for federally qualified behavioral health clinics. And frankly, it's one of the reasons that we had such strong support from the law enforcement community across the country to be able to move forward in this way, so that we can make sure people are getting the emergency care that they need in a emergency psychiatric setting, rather than in the jail or in the emergency room of the hospital. And we know that if things are done right, we can keep people out of long-term care in hospitals and give them the support that they need, the medication, the treatment, to be successful and go on and live healthy lives.